So hello friends, now in this particular video we are going to discuss another pathology of the lung, that is obstructive lung disease. So in our previous two videos we have discussed from notes, but obstructive lung disease is not given in so detail in my notes, so I will prefer to discuss separate. Okay, so this will be our probably third video, okay, third or fourth video. So let's start with the obstructive lung diseases, OLD, obstructive lung diseases. Now it comprises of four diseases. So the first is your emphysema, I will write short form. Okay, the second form is your chronic bronchitis, the third one is asthma, and the fourth one is your bronchiectasis. So these are the four obstructive lung diseases: emphysema, chronic bronchitis, asthma, and your bronchiectasis. Clear? Now among these two, emphysema and chronic bronchitis, these two are categorized under COPD, means chronic obstructive pulmonary diseases. So remember this, these all are obstructive lung disease, and in that chronic obstructive pulmonary disease are then these two, emphysema and chronic bronchitis. So let's start with the discussion of emphysema in detail. So we will focus on emphysema first, then we will discuss other. So coming to emphysema, so first we will define emphysema. So please listen the definition. It is irreversible. I will mention the important words which is important definition. So it is irreversible dilatation, means permanent dilatation of the air spaces which are distal to your terminal bronchioles, that must be distal to terminal bronchiole. So irreversible dilatation, what irreversible dilatation? So irreversible dilatation of the air spaces which are distal to terminal bronchiole, which must be distal to terminal bronchioles, and there must not be any fibrosis, no obvious fibrosis will be seen here. Clear? There will be destruction of bulb, but there will be no fibrosis. So this is the basic definition of emphysema. So let's discuss the types of emphysema, then we will discuss the morphology and pathology of emphysema. So type, so first type is your centri-acinar type. Okay, the first type is the centri-acinar, as the name itself suggesting centri-acinar, means it will involve the central part of acini. Okay, it will involve central part of acini. So acini central part will be involved in centri-acinar type of emphysema. Clear? What is acinus? Acinus is basically air spaces which are distal to terminal bronchiole. So after terminal bronchiole, all other are included under acinus, which include respiratory bronchiole, alveolar duct, and alveolus. Okay, that part is acinus. So in particular, in the distal to terminal bronchiole, it involves central part. Okay, so central part of acini is involved in centri-acinar. Now the next point, that it is mainly associated in heavy smokers. Heavy smokers, mainly associated with heavy smokers, also seen in chronic bronchitis patient or coal workers pneumoconiosis patient, but mainly it is associated with heavy smoking. Clear? Okay. Now next type is your pan-acinar. The name itself suggesting pan means it will involve all the air spaces which are beyond terminal bronchiole, means it will involve full acinus. I am again repeating, what is acinus? The air spaces which are distal to terminal bronchiole is known as acinus. So pan-acinar, pan means involving whole of the acini, means whole part which are distal to terminal bronchiole, and this is basically associated with alpha 1 antitrypsin deficiency. This is mainly associated with alpha 1 antitrypsin deficiency. Clear? And this pan-acinar will mainly involve your lower lobes. It mainly involves lower lobes. This centri-acinar will mainly involve upper lobes. So let's move to the third one, that is distal acinar. Okay, distal acinar emphysema, or it is also known as paraseptal emphysema. Clear? Okay, so it involves the air spaces which are the periphery of lobule. Okay, so distal means most distant, so it involves mainly peripheral lobule. Okay, and in this proximal is normal, proximal portion of acini is normal, distal portion, peripheral portion of acini is disturbed here. Clear? And when you will get dilated spaces of more than 1 centimeter inside, then that will be known as bullae. So bullae may be seen in distal acinar type of emphysema. Clear? And how it is associated? So it is associated basically with fibrosis, scarring, like this. Okay, fibrosis, scarring. In that case, distal acinar will be seen. And the last one is your irregular type. Okay, a sinus is irregularly involved. So irregular type. So these are the 4 types. Just remember the types: centroacinar, then distal acinar, then your irregular, and this panacinar. So these are the 4 basic types of emphysema. Now, coming to the etiology and pathogenesis first. The important is pathogenesis. So suppose this is environmental factors, okay, here, and here is your genetic factors. So both factors involving here: genetic factor, environmental factor. Environmental factor means exposure to toxic substances such as tobacco smoke or fuel. Or here genetic factor means alpha antitrypsin deficiency. Here I have told smoke, dust, fuel, like this. Okay, clear? Now this part, smoke, dust or fuel, this will stimulate your macrophage which are present in lung. Macrophage stimulation is there, and that macrophage will release inflammatory mediators. That macrophage will release inflammatory mediators. So inflammatory mediators will be released from that macrophage. Okay, inflammatory mediators will be released from macrophages such as leukotriene, B4, interleukin 8, like this. And these inflammatory mediators will induce inflammatory response. Simple. Inflammatory response or inflammatory reaction it will induce. Getting my point? Now, alpha 1 antitrypsin deficiency. So if alpha antitrypsin deficiency is absent, if alpha 1 antitrypsin enzyme is absent, then there will be protease, okay, protease, anti-protease imbalance will be created, because this alpha antitrypsin basically it degrades protease enzyme such as elastase, and if this alpha 1 antitrypsin is deficient, then there will be less amount of anti-protease, so the dominant activity will be of protease, so there will be protease anti-protease this imbalance, and this protease enzyme will then cause destruction of alveolar parenchyma. Okay, destruction of alveolar parenchyma is done by this protease. This induced inflammatory response also causes destruction of alveolar parenchyma. Suppose in between an infection comes, so infection also induces inflammatory mediators, so it will also cause destruction of your alveolar parenchyma. Clear? Okay. Now this environmental agents, smokes, dust, this also create oxidative stress. This also create oxidative stress that also damage destruction, that also causes damaging of alveolar parenchyma. Some where free radicals are formed, and this free radicals will also causes destruction of alveolar parenchyma. So just basic is this, that you have to go for the 2 factors, environmental and genetic factor. In genetic, alpha 1 antitrypsin deficiency, here this, and macrophage activation, inflammatory mediators release, induces inflammatory response, and there will be destruction of alveolar parenchyma. So this is the basic pathology of this. Now on morphology, what you will get? On morphology, what you will get? So on gross, it mainly involve your upper 2/3 of the lung. Okay, so emphysema mainly involve upper 2/3 of the lung. The lung will be voluminous. Bullae may be seen. If bullae formation is occurring, then bullae may be seen. And on microscopy, what you will get on microscope?